Well, hello and welcome to today's HIPAA Chat, Ransomware and HIPAA Breaches. I'm Carol Fly with High-Tech Answers. Thanks for joining us today. If you're new to HIPAA Chat, sit back, listen for a bit as we talk about ransomware and everything about it, which is crazy in the news right now. And we'll spend the bulk of our time together answering questions from the registrants and from the live audience. So you can use the GoToWebinar dashboard to pose a question, and we'll get to as many as we possibly can. HIPAA Chat is sponsored by eFax Corporate, and it has been for the last couple of years. Without their support, HIPAA Chat would not be possible. So please check them out at enterprise.efax.com. They do have products that deal with the secure transmission of ePHI. We do have some resources for you to check out post-event. First of all of our HIPAA Chats are recorded and then uploaded to YouTube as videos. And so if you go to YouTube, if you're looking at the slide deck, I've provided a link here, but you can go to YouTube and search on High-Tech Answers channel or Healthcare Now Radio and you will find them. Our podcasts, we do all of our webinars. We reconvert them to podcast to air on our internet radio station, healthcarenowradio.com, and you can check out those podcasts at healthcarenowradio.com as well. We also stream a HIPAA Chat live at 12 noon or 7 p.m. Eastern on our internet radio platform, which is healthcarenowradio.airtime.pro. And finally, follow us in HIPAA Chat on LinkedIn. If you go to HIPAA Chat and search in groups, you will find us where we continue on the conversation. So, of course, our experts are Bob Grant and Mark Haskelson from the Compliancy Group. They're here to address our questions on ransomware and HIPAA breaches. But before we begin, I think we want to just give our audience and our attendees sort of an overview of this topic that has made so much news recently and a concern for everybody. And first and foremost, let's just maybe give everybody an audience as to exactly what is ransomware.
Hey, Carol, it's Mark. Thank you, everybody, for joining us today. All right, so there are a lot of different things that can happen where you are getting your systems attacked, your data corrupted, etc. But ransomware is rather specific in that what they are doing, and there's a couple different types of ransomware, but in the end, what they're doing is they are accessing your system, and the ways that they get in, we'll talk about it in a minute. But ultimately, what they have done is they've taken your information. They have either encrypted it, and there's a couple different types of encryption where you can either only access some pieces of your data, or they have locked you out of all of your data. What they want back, though, is money. Okay, now, so this is not, they're not, at least in today's world, ransomware is they were not looking to steal your data. They were looking to take your data and that force you to pay them some sort of ransom for you to get access to your data. Although, whatever your feeling is about the idea of paying a ransom, the unfortunate part is sometimes you do pay the ransom and they give you back your data with no restrictions. Other times they take your money and they don't give you back your data at all. And much more what is kind of fearful about this is you really don't know who these people are, where the money is going, etc. So, it is one of those things where there are hopefully some ways you're working with your IT and security firms to prevent it from happening, but that you are doing all the correct things that you can that if it does happen to you, to mitigate or reduce the damage that happens.
And sometimes it also made the news that money and Bitcoin. I mean, it's the definition of the actual ransom obviously varies, right?
Oh yeah, I mean what we're seeing is so many different ways that they're okay.
Yeah. So ransomware, how does it spread? I've obviously listed 5 ways it could possibly spread, but maybe we can talk about this for a little bit as well, because that's I think a confusing aspect for a lot of providers.
Well, what's kind of tough about ransomware compared to, let's say, viruses and all the systems you have in place to protect yourself against viruses and much of the malware that exists, unfortunately, when it comes to ransomware, they can come at you from just about any angle. So it can be, an email that came from a strange destination or is trying to impersonate a real email that you would have gotten. So I've seen, let's say, I use Chase Bank. I saw an email. It looked like a Chase email, and they wanted me to click on something, but when I took a good look at the URL that it was coming from, it clearly wasn't coming from Chase. So there are, spam email messages are a definite problem. The issue of when you are moving around in the web in general, you could legitimately be going somewhere, looking something up, hit a site that you click on, one of the various different buttons that might open for you, that in essence are opening up what is an executable file, which means you've now allowed a system, you've allowed a foreign body into your network, and the damage that it can do can be rather severe. Often we're seeing, you see an article, you see a nice white paper, for example, some of the ones like, not the ones from High Tech Answers, mind you, but you might see an invitation to download a white paper. It looks kind of interesting, so you fill out the basic information, and then poof, when you open it up, really what you're doing is opening up ransomware into your system. Unfortunately, because so many of these, the ones, you have lots of good technology, I hope, scrubbing your systems and trying to protect you, but at the end of the day, you could, with absolutely no malintent, open up something that causes this harm. So, a lot of things that you can do are just common sense, look at the things that you're receiving, make sure they're really coming from legitimate destinations. If you are not sure, do not open it. If you have an IT group, forward it to them or ask their advice. About the one thing that we're hearing time and time again from the security experts we work with is I'm not going to say your only defense, but your best defense is having backed up your data as recently and as often as possible. Because understand, what they've done is they've stolen your data. Now, if your last backup was 2 weeks ago, and let's say whether or not you paid the ransomware or not, you didn't get it, now when you restore, you're 2 weeks out of date. And that could be obviously depending on what you do, or just about any business. If you were 2 weeks out of date, that's a tremendous amount of data that's lost. And especially when you're talking about healthcare, the services you provide are critical.
Right.
All right. So, Carol, you want to talk about that for a little bit?
Yeah, well, obviously, if you Google or you watch the news, obviously healthcare is one of the industries, being hit hard right now, ransomware. As you can see from the stats, I think it's 88% of all ransomware is detected in the healthcare industry. I think that was reported by Healthcare IT News. This is really widespread. Is it what are you guys seeing in hearing? Is it mostly hospitals? Is it small providers, big any providers? I mean, is it across the spectrum? Who's most at risk?
I think, unfortunately, everybody's at risk. This is, large or small. Often these are they are nets that were thrown wide, if you want to call it, and they'll scoop up whoever unfortunately clicks, opens, and lets this malware into their system. One of the things that is really, really problematic is some of these ransomwares lay dormant for what could be months. Okay, right. So that it's not even a direct relationship to something you did today. So they can be, picking away in your platform for you don't know how long. Now, right. One of the reasons why, although I think where the data point about the majority of it being targeted at healthcare, I think a lot of that has to do with two things. One, the value of your information is high, okay? And two, if you think of the amount of people that are involved in the healthcare transaction, there are only, X number of thousands of banks in the country, right? There's only so many, endpoints on the credit card interchanges. Healthcare, on the other hand, you have everything from, your local dentist to your regional hospital to, EHR platforms that are serving hundreds of thousands of medical groups as well as their patients. So you are a very big target. Yeah. And that's one of the reasons why we think we see so much of it going on, specifically in healthcare.
pharmacies, insurance companies. We
Oh
forget
yeah.
it's not just doctors and hospitals, right? Right.
Oh,
And there's a huge cost per record, right? I mean, it's sort of like if you think about how many medical records you have, like that 363 average cost of healthcare data breach per record. Well, if you have, the math adds up pretty quick. If you have 1,000 records, and or 500 or 100 even, that's a lot of money.
And Carol, that's not including the fine.
Right. If a breach has been determined and they come in and they decide that there's been negligence in a fine.
And I will say just what I was telling you before, that if your data is not encrypted and you have ransomware on your system, it's up to you, the entity, to prove that the data wasn't accessed. Well, how do you know if the data wasn't accessed? Because you're locked out of your systems. So the government's going to say, well, you need to prove to me that it wasn't. Because if your data is not encrypted and they could access the data, then that's a breach. So having your data encrypted goes a long way when it comes to get out of jail card free. Otherwise, they can determine that the data was a breach and you're going to get fined. Plus, you're going to have to go through the $363 record of having to notify them and give them, credit monitoring and things like that.
Right. And the reputational costs going forward, as the stat shows, 48% of patients would change provider after a data breach. The consequences, it's a pay it forward in a bad way.
Right.
Oh yeah. Well, the other thing you see, which is one of the challenges the value of healthcare information is much higher than other types of stolen information. So separate of the 363 cost to you to deal with the breach, in the black market, ultimately the value of healthcare information versus traditional financial information is 3 to 5 times. So where stealing someone's bank information might be worth $200, stealing someone's healthcare information can be worth north of $1,200 to $1,500 because there's a lot more you can do with it. And along the idea of the stats you see on the bottom of the page there, one of the studies we've seen is that of people who have had identity theft perpetrated against them, 58% of them believe it originated from their healthcare provider. Okay?
Oh, wow.
So that even there's very definitive belief and evidence that healthcare not only is a preferred target, but that the average consumer realizes. And it's one of the reasons why when we talk about the general concept of HIPAA and security and protecting your information, separate of checking off a box, putting the right protective measures in place in advance is really helping you limit the damage that will happen. And I say will happen because I think, and Bob we've talked about this in other HIPAA chat sessions. Stop looking about what if. Start planning on that at some point you will have a breach. It will most likely cause you to be audited. And are you in a good position to be able to protect your patient's information, your reputation, and then ultimately when an auditor comes and says, prove it to us that you did everything you were supposed to do, that you're not going to be facing a substantive fine.
And just on a side segue note, do you guys think it was the Anthem breach that really brought this to the forefront in the patient's mind? I mean, or do you think it's just that, this is the world we live in, and banking, their bank records and their medical records are at risk, to me that felt like a watershed moment.
Well, I agree 100%. I think that brought it to the forefront. I mean, it's always been there. Breaches have always happened. They've always been reported, but you have to remember this. Most people would go, what's a breach? What does that do? How does that affect me? Right? But now, as more and more the news takes a hold of it and starts educating, when you start educating the public, you start educating them against you, the media starts educating them against the provider, because if the provider has one, that's why 48% of the people change, because they now know,
Right.
oh my gosh, my data, my social security number, my this, my that is all out there in the open.
Everything.
I'm not going. Exactly. So as they get more educated of what it is, then they're going to start rebelling against you, basically.
I also think, you know, some of this is the media itself, but if you think of just the last 2 years, I think Anthem, and it was not their first breach, by the way.
No,
it was actually their third. You have media loves this. It's very sexy, right? If you look at CNN specials, but if you just look at the last 12 months, you had Dr. Oz, Prince's medical records,
right?
Whatever the prince. Who's the prince and his wife? What the name of the gender of their baby?
Yeah,
right.
It was,
Pierre Paul, the football player.
Mm-hmm.
You know, these are all people these are public figures that had data exposed, and the average. You know, I often, it used to be we talked about patients. I try when a lot of times when we're speaking to people, I said these people are now consumers. Okay, they're now treating you. They go on the web. They do background searches. They look at your websites and what your health grade rating is, etc. It's like Amazon. They're going to choose who to go to, and if you have a black mark, they go elsewhere.
Yeah, I mean that this whole sort of issue obviously is sort of dovetailed with the rise of the consumerism of healthcare, and so it's, I don't know, I guess a bit of a perfect storm, I guess. All right, so finally, and really sort of was kind of the last, but certainly not least, is the lead-in for our Q&A and questions on this topic. OCR recently released their sort of guidance to help providers on ransomware. Although you can see that they didn't amend HIPAA, but they did give some guidance. Maybe we can talk, Bob especially, talk a little bit about what this guidance contained.
Okay, so actually the HIPAA rule, right, and the security management process does address a lot of it. One of the things that there's not much you can change is your employees, right? And so where do most of these ransomwares hit? Naked pictures of Kornikova or whatever, it's the old a Friends episode where Chandler goes in and he picks up this email and wipes the whole hard drive, okay? So one of your employees, not meaning to, sees something come up and goes, ooh, I'm interested, and clicks on it and just opens up your system to and then closes it down, basically. So the one thing that you have to, there's a couple of things you need to do. That risk assessment needs to look at all of your technical systems. It needs to make sure that you run penetration scans and vulnerability scans on your network, that you have training, constantly training your staff and sending reminders. Do not open documents you don't know. You must constantly tell them that. Mm-hmm. And I'm not talking once a year, right? There's the rule states that you must send security reminders every quarter. Okay? So that security reminder every quarter could be, don't open documents that you don't know. Okay? The risk assessment going into looking at your technical, your physical, you don't really have to, I mean, for this, they're not going to come in physically, but your technical side and your administrative side of your security. Now, the one thing Mark mentioned was backups, right? So if most people, the rule is you're supposed to back up every day. But some people don't do it, right? If you're that, 2-doctor practice with 8 people, we'll back up. It's too cumbersome to back up. If you think it's too cumbersome to back up because you're backing up on site, which is never a good idea, because if you're building birds down, now you've got nothing, right? We have so many new-fangled things we can do. You can get a cloud that automatically backs your stuff to the cloud. That way, if your server's stolen, if your server is hacked, if your server gets ransomware, you could just get a new server and download the data back on there because it's 1 day later or 2 days later, whatever it is. But so if you automatically back your data up somewhere else, you're going to be able to get your data back. You don't have to worry about that ransomware. The only thing you have to worry about is explaining to the government that you had it and that none of the data was breached. So here's another thing, too, that the rule says. If you find that you get this malware, if you have any malware, you're supposed to immediately unplug that computer from the network. Don't let it just sit there and try to fix it while it's still online. Unplug it, then try and fix it. Don't let it spread to your other systems, because once it gets onto the server, that's where they're going to lock you down. If it's just on your workstation, so they're not going to. They're waiting for that server and that workstation to mesh up for something so that they could pass that on to there. As soon as your antivirus says you have a malware, unplug the computer. You'll see that over and over in the statements from HHS.
Make it an island. I mean, you just got to take it. I mean, you got to break the daisy chain, right?
Because the longer it sits there, the more computers it's infecting.
Right. And OCR's ransomware guidance. It's available online.
Yes, sir. Not ma'am. Sorry.
Yeah.
Yes.
Oh, that's okay.
I constantly and don't. It's not the first time I've done that.
I have a twin brother. David might be subbing in today. You don't know.
But yes, this stuff is all online. It's not a protected thing of what you should do. Right. So, like I said, making sure your risk analysis is done, making sure that your people are trained, making sure you encrypt your data. Now, encrypting your data has a kind of a twofold thing here. Number one, they can't go onto the hard drive and see what's there because it's encrypted. Number two, if you have that, safe harbor laws come into play, and you kind of get like a get out of jail card free because you made that good faith effort to protect the data. And I'm always telling this about people. Nowhere in the rule does it say you need to be compliant. What the rule says is you need to make a good faith effort. So let's say I do this and I do that, but I don't want to do this because it's just such a hassle. Is that a good faith effort? Absolutely not. I'm going to do this and this and this, and I'll put an extra lock on my server. I'm not going to encrypt it because it slows the system down just a little too much. Well, if it slows the system down, get a better internet, right? Don't do something because it imposes an issue with the rest of your site. Fix that too then. Because look, 323 times 16,000 patients times the fine you're going to get, you're out of business. Right. You are out of business.
That the exponential, cost of record, right? Okay. Well, alrighty. So with that, we're going to start taking some questions. Just a remind our live audience to use the question feature on the dashboard, and we're going to get to as many questions as we can between now and the top of the hour. So anyway, first question. So how are we expected to determine whether or not a breach has occurred in the instance of ransomware infected PC? Meaning, do they just wait for the ransom to be made? I mean, is there, how are they supposed to detect this? I mean, you just don't know until you actually get, notification that we want so much money.
See the guy, yeah. So they're going to send you an email.
Yeah, hey, chicken or egg. Yeah.
If you give us, 2,000
or sometimes, Carol, what happens is you don't really know until you click on a file, you try to open it, and you can't.
Yeah.
Right.
Right, and then that's what kicks off the messaging saying, hey, listen, if you want to open this file, write it, send us $10,000 in Bitcoin, and you can access this file.
Right.
And but I guess my question is there any? Yeah.
So like I said before, the proof is on you. Well, since you couldn't access your system and you don't know what they're doing, if your files weren't encrypted, you can't prove that it wasn't breached. Because there's, like Mark was saying at the beginning, there's different types of ransomware. There's some ransomware that lock you out. There's some ransomware that lock you out while they still have access. So you have to prove
you're going to have to get in and you're going to have to run reports and hope that your system was tracking what was going on behind the scenes to be able to prove to the government. It's not the government's job to come in and say, oh, you were breached. It's your job to prove that you weren't breached.
Right.
That's a whole different issue, right?
Right.
Like going to a tax audit.
Yeah. Do you have to, another question, do you have to passcode every file on shared devices, or is there another way to protect besides just viral protection?
Encryption.
It's encryption issue, yeah.
Yeah, if you have it encrypted, then, you know, the only people that have access to the file that are people who are in the network, right? So, yeah, of course, you don't have to password everything on that drive, but that drive should be run over encrypted files, encrypted lines, right? HTTPS, 256-bit encryption, and the file should be encrypted, 256-bit encryption. So the file's encrypted at rest, and it's encrypted when you're accessing it.
And if you're sharing EPHI, electronic personal health information, it has to be encrypted.
Well, if you're accessing it, it has to be encrypted, and it should be encrypted at rest. But like I said before, sometimes when you encrypt things, there's issues with encryption. So, for example, in a large hospital information system, right? A large hospital may have homegrown systems. For example, they may have a homegrown lab or an X-ray software, right? That won't understand. If you take your main system and encrypt the hard drives, now you've shut down your whole hospital because your homegrown lab and your X-ray can't talk to it. It doesn't know what it's sending to it. So there's no way for the system to do that because it was homegrown, okay? Now, as we have moved on from away from homegrown to full, let's say it's an Epic system, right? A full Epic system where X-ray and EHR and all the, everything that's on the network can talk to each other, then you can encrypt the data. But some places have a problem with that. So guess what? They don't encrypt. Then they get a this malware, ransomware, and now they're screwed. So, I'm not telling people you got to spend $100,000 and upgrade your system. The thing is, then, if you can't encrypt your data, you need to train your staff every week. You need to send out reminders. Don't open things, right? You need to make sure you're doing security analysis all the time, running antivirus every day, maybe twice a day. Because if your system's not encrypted and your main database is sitting open, you could run into a lot of problems.
Right. So if ransomware, you're encrypting your ePHI, so how do you reconcile safe harbor achieved by encrypting PHI with a ransomware attack when you're already encrypting?
Well, so if ransomware comes in and shuts down your system, right? What you have now, you're going to go and get your data back up, and you're going to back it up onto a new server. You're going to get rid of that server that's there. But when you report to HHS, you're going to report that, and you'll have the proof, because your security risk analysis tells you have to write down on a proper security risk analysis. You're going to write down every device and how you're protecting each device. So if I have PHI on this device, I'm going to show that it was encrypted. And my risk analysis, let's say, was January 1 of this year. Okay? And now September I get one. I'm able to show the government that on January 1 of this year, our drives were encrypted, which means they're still encrypted today, because you don't unencrypt drives. And the government will look and say, oh, so before this happened, you had encryption, so there's no way for them to look at the data on the hard drive. Okay, you're good. You made a good faith effort. Thank you. But if you can't prove that, then you're right down the road again of saying, they're going to say, well, was the data encrypted or not? Well, it was. Well, where's your proof? I don't have any. Yep, then it wasn't then. In their eyes, they'll say it wasn't.
Going back to a remark that you made, can you please explain that if a hard drive is encrypted, you get out of jail free? Whole disk encryption only provides protection when a drive is at rest and the operating system is not booted up.
Mm-hmm. So look, when they shut down your system, right? They're not going to have a login to your system. Okay? So they don't have a login. So the only way they can look at that hard drive is to go into the hard drive. So they don't have a login. The system's just locked out. But if they have access to that box, which they do at that point, they can look on the hard drive, right? But if the hard drive's encrypted and it's sitting there as encrypted, they won't be able to see anything.
So they still can't tell that. Is that what you're saying?
They can't see it. They won't be able to see what's on the drive. They can't see it.
Right. The ransomware.
To explain it better, if I had a safe in my office,
right,
and you stole my safe,
yes,
you have my safe, which means I'm screwed, right? But because you don't have the combination or the key, you can't use it either. Okay? So it still has great value to us to get it back, but you can't use that data and, let's say, for example, sell the data on the open market to be used for other purposes. So to Bob's point, they still have your data, but they can't use it either. Right. So the damage, you're right, reducing the risk.
Right.
But you're reducing the risk for the end user.
Right.
Still report the breach, though, obviously.
Oh, absolutely.
Yeah.
But you have the proof to show you made a good faith effort to protect it.
Right. Okay. Right.
And the reason why I think that's important is you don't get fined for the breach. You get fined for not being able to prove your compliance. So you had to report the breach, right? Because ransomware, unless you could, as Bob was saying, unless you can prove without a shadow of a doubt that was not accessed, you got to report it. Now what happens is the auditor is going to say, okay, great, that's a horrible thing that happened to you. While we're talking, please give us your audits and your remediation plan. And then, now all of a sudden you're looking at the $2.7 million fines that we've seen in the last couple of months of firms that, let's say, for example, lost a laptop.
Right. Backups are great, encryption is great, but do you guys have any sense of how many ransomware incidents are actually resulting in breaches and how large?
Mark?
I don't know. It's a good question. I think there's two problems with that. One,
we hear about the ones in the media, of course, that are reported.
Exactly.
Those are the ones that we hear about.
Yeah.
So it's really hard to know, isn't it? I mean, unless there's the HHS Wall of Shame, of course, but again, we hear about the ones that make the news, but that could be obviously the tip of the iceberg, I guess.
Well, those are usually the ones that. Those are usually the ones where they couldn't prove, so the breach was validated. Let's say, right? So those are the ones where you see that type of issue going on. But the ones where it happens, okay, how many are going to happen? No, I don't think anybody really knows. I know one thing.
Yeah, I don't think I think the markets. Right now, I think half of it is, people are embarrassed or fearful of repercussions, so they're not telling anybody.
Right.
We hear about the ones that want to publicize it, but
Right.
if there really is 4,000 a day happening, who's actually paying the money? Who's actually getting violated? They're not saying.
Right.
That's a great point. Unfortunately, we don't know.
Yeah, of course, under the HITECH Act, of course, if you have a breach with over 500 records affected, by law, you have to report it to the media. So obviously that's why we're hearing about these larger incidents, right?
Exactly.
Yeah. Sort of a kind of a technical question here. If a medical office has shared drives for data and access to the shared drive is driven by user permissions, should you put encrypted software on all shared drives similar to laptops, or should you passcode every single file folder within each shared drive?
No, I think it would be a lot easier if you just encrypt it.
Yeah.
Yeah, that's a no-brainer there. Just encrypt the drive like you would a laptop. Yeah.
Right.
Yeah, that's just so much easier for you, because otherwise, you've got somebody adding a file folder there and forgets, right? Now you run that risk of if it happens to you, that one wasn't protected. So it's just easier to protect the drive.
Right. Back to Mark's analogy about the safe in the provider's office. Just clarification from one of our attendees: if the ransomware attack is considered a reportable breach, if there is no data taken, meaning the ransomware occurred, but they couldn't access the data that was stolen.
Okay, and you prove that to the government how?
You have to prove it, right? Well, that's
Mm-hmm.
I guess
you
you
that, right?
Yeah.
Right. So then you can't, if you can't prove it, then the assumption is that they did. That's their assumption. That's not mine. That's not me saying that. That's what they have said.
They'll assume it.
They assume that, yeah.
They'll assume that they somehow were able to break into your safe.
Yes, ma'am. They
Right.
took a sledgehammer to it, or
They
whatever.
took a sledgehammer to it. Yeah, blew it up. Yeah. I'm confused. If we have malware antivirusware installed in our network, I'm assuming it's checking all the time. Is that wrong? Well, I guess.
Okay.
First of all, that's, I guess, depending on the software and the right.
So yeah, so you know what? I have people all the time. I've got antivirus, and it runs periodically. Oh, but we forgot to check the box with the definitions, so the definitions haven't been updated in 2 years. Or I'm using a free version, and we only get some of the definitions and not all of them, right? So the software is only looking for, the software is sitting there looking for something that is attacking your system. So if you open up some document and it has something that just sits there, and it's not going to attack your system till it gets to the server, your malware system may not see it. Your antivirus may not see it because it may not be, if it's not attacking your files, because that's how. So what happens is so everybody knows this, when you get a virus or malware, the way that the software knows that something's going on is that on your hard drive and in a file is the correct file size for every file that's on your system, 256K, okay? So what an antivirus system does is it looks at that file and it looks at the file that's on your computer. If the log file says it should be 256, but the file on your computer says 2156, it goes, there's something wrong with that file. I'm going to kick this out because there's a virus in there. So it's looking for it when it starts to attack, but if it just sits there and it's waiting so that it can go through your system to get to your server, you may never see it. That's why you have to train your staff not to do that. Now, eventually what's going to happen is, and it's going to be too late, is that it's going to attack the server. The antivirus is going to say, hey, forget it, it's over. Now you're locked out. And the antivirus didn't have time to get to it because it's already at the server.
Bob, just a clarification, just because I want to be sure as we're using a couple different words here. Antivirus and anti-malware are not necessarily the same pieces of software being run. So just because you have a known antivirus application running,
right.
Do not presume that is also free, an anti-malware application. So please make sure for those on the call that you're running both.
Right.
Because the virus is well, it's a virus. So the idea behind a virus is that it spreads from place to place to place, and it could be spreading to places outside of your organization and practice, right? It's like 6 degrees of separation. Whereas ransomware, one of the attendees chimed in, ransomware is not like a virus or a malware per se, because it's a very specific target, correct?
It still attacks your system.
Can it affect other users?
Outside of your system?
Right.
You know what? And here's the thing is, right?
I've not heard that. But
yeah.
I've not heard that either.
Yeah.
No.
But I'm sure as they evolve, they'll get smarter and find ways to do that too.
Right, because wouldn't that be the best way to do that, right? You share a file, and there it is, and now your organization is sharing malware across, the whole United States. Maybe you're an insurance company, right? And I'm returning EOBs to you, and I'm infecting your system, right?
Right. Or your as far as the ransom concerns, your ransom just got a whole lot bigger.
Right. Mm-hmm.
Right. And certainly this comes into play too, obviously, with health information exchange as we move towards interoperability, and we're now exchanging these patient records, from our provider organizations to the hospital and back down again, obviously. I mean, this is where we're moving to as an industry, is full interoperability a la the banking system. So, yeah. Are there, if this happens and there's a ransomware attack, is there police involvement? Do we involve the police? Is this an FBI issue? These large, especially these large hospitals, it could be any size, I suppose. But can they do anything to help catch the people who are doing this?
They can help you, yeah. And I suppose that once you reported it to HHS, especially depending on your size, they would inform you of what to do, right? They would inform you, should we call the FBI? Should we call the local police, or what to do? So like the first place to go would be, I think the first place you would go is your lawyer.
Oh, yeah, right.
So before you do anything and you start calling the police and calling this and that around, the first thing you want to do is call your, right? And you want your lawyer involved to mitigate the issues, so not to increase your fine because of things that people may say. So the first thing you're going to want to do is call your lawyer, and then you're going to want to do a risk analysis, and you're going to want to gather all your HIPAA documentation, and you're going to want to be prepared to show that HIPAA documentation after the lawyer, calls HHS, and they say now, because they're going to say, okay, I want to see A, B, C, D, E, F, G, send it to me. And then you're going to send it to them, and then they'll inform you, okay, what you should do, right? And it may be, okay, go ahead and, you've already unplugged that server from your system, get a new server, get your data backed up on there, run an antivirus, run a malware on it to see if it was in your backups, right? So you don't know how long it's been there, so you don't know how many backups you're going to have to go back. That's another thing.
It's interesting, one of our attendees chatted in that there is a website where you can go to report a ransomware crime, and it's according to the attendee, www.ic3.gov. So I guess you could. I don't know if she Googled it or she just knew that, but apparently there is a place which would be really helpful, I think, especially for the FBI. Trying to find perpetrators of this kind of crime, right? Sure.
But by the way, just to point something out, this is how a lot of people get in trouble, because someone says, hey, go to this URL, and then they go to the URL and it says, click this, and boom, you just open malware. I don't think that's the case in this one, but please be aware that is the way sometimes these things are done.
The attendee said she had attended a conference with the FBI agents in attendance, and they provided that website.
All right, okay, then I'm feeling good. Then we can all be associated with that.
That's pretty good. So I have this question's related to vaporware. Maybe we can even, when I ask this question, maybe we could step back for a second and delineate very quickly, ransomware versus malware versus vaporware. It's a lot of ware. Sophos, obviously a vendor, is selling a product purported to decrypt files as they are being ransomware encrypted via information in RAM before the malware phones home. I mean, that's when it spreads. Is this vaporware? I didn't know there was another ware out there. I mean, I know ransomware and malware. I've never heard of vaporware. My bad.
Being a software developer, what vaporware is I've got the product that ends all when it comes to this solution, and we do it this way and this. but I don't really have it. I mean, I just have a concept, and I'm thinking, I'm building on it. It's not real. That's what the person's asking. Is this real? I don't know. I don't know what this company has or has not. But let me just tell you, anything that you can put into place technically that can monitor your systems, you should try to do, but it's expensive. It's not cheap, right? Because you end up having something that is sitting on your every system, because now you have something that's sitting on every system, monitoring something that everybody's doing there. So of course you're going to take a hit on performance, but you're going to take a less hit at the end, because this software, if it does what they say it does, right, it will alert you that that you have this ransomware sitting there, because it knows. Okay, so if that is the case, yes, but be prepared that it's probably going to cost a pretty penny, because it's going to have to be by each device, and it's going to being on a device, you're probably going to take a hit on your performance.
Right.
So you know.
Right. Right.
But is it good? It's up to you to make that determination, though, right? If it's good or not.
Just as an FYI, and we're not suggesting anything, but for example, one of the applications we've seen used is a product called Malwarebytes.
Yeah, sure.
They have a free and a pay version.
Mm-hmm.
So and I think the full pay version is $100. So
it's been around a long time too. Mm-hmm.
Yeah.
Yeah.
So it's not necessary. It doesn't have to break the bank, but please do something.
Right.
Does the OCR ransomware guidance that was put out, does it, and I know the answer to this, but Mark, maybe you can jump in here, does it address what BAs should do, business associates?
Well, business associates under the law are required to comply with the HIPAA security rule, right?
Yeah.
So everything that we've been talking about today, the risk analysis, the security reminders, is everything that you have to do for security. So they have to do the same thing.
As of 2013, the omnibus have pretty much held the same standards as CEs.
Mm-hmm.
Right?
Yep. When it comes to security. Mm-hmm.
Right. Just to step back for a second, could you kind of review or give us 3 or 4 best practices as to what we should be doing to mitigate or reduce our risk of ransomware? I mean, you guys have, I know you talked about training and encryption, anything else, security risk analysis. I mean, what else should we be looking at? I just basically cobbled together 5 different questions.
So I think that if you look at the standards for HIPAA, right, you would meet exactly what you're talking about. Number 1 is a risk analysis, and having the proper policies and procedures in place, and making sure everything that you found wrong technically, physically, administratively under the security rule, that you fixed it, right? Having the proper policies and having the staff trained on it, having security reminders to remind the staff not to do certain things, making sure that you have encryption on all your drives, and making sure that you have, a malware software also and antivirus running. Those 5 things right there would help you tremendously, right? And then if something did happen where your staff did bring something in, that's why you have to, under HHS and OCR and Medicare, you have to have a sanction policy that says if you violate HIPAA federal regulations after I busted my butt to do all this stuff for you, then you're out of here. You're fired. You're gone.
Right.
And so, but that comes under the policy. So I can fit the whole security thing in those five suggestions. Where, oh, what about this? Well, that falls under here. Or what about that? That falls under here. So if you do those 5 things, you're pretty secure. At that point, you can at least show the government you made a good faith effort, right? So, going back to my thing about you don't have to be 100% compliant, but you best be able to show you made a good faith effort.
Right. And just to remind the people that are asking, again, if you go to Google and go to the HHS OCR website, you will find their ransomware guidance. Question from the registrants: is this like the first step from OCR to provide guidance? Do you see, additional guidance for risk assessments to cover the threat of ransomware coming down the pike? Or, my big question is, where do you see them fitting into this as we go forward?
My opinion is that they will make a change to the risk analysis and to the requirements, that they will require you to have not only antivirus, but to have malware software, right? That's number one. But I don't see any changes till 2020, and that's what I've heard, because they're doing audits right now. So you can't be doing audits and change the rule, because then the audits have to stop, because then they have to go back and redo the risk analysis. So because they're doing audits right now and they've been ongoing, that you're not going to see, you won't see a rule change for a while.
And those phase 2 audits, my understanding is that those are, right now, they're not fine audits, but a lot of what they're doing is gathering information, and like where the holes need to be plugged, and maybe this is part of what they're looking at in phase 2 audits.
Oh, people are getting fined. Somebody just got fined Somebody just got fined $400,000.
Oh, for something egregious, right?
Yeah.
Right.
So they are doing fines, but most of it, and if you read the rule, a lot of it is if no breach has occurred and there's minor violations, they'll give you a small fine and give you X amount of time to fix it. Okay? But if they walk in and you got nothing, they're going to fine you. There's no doubt about it, right? And
well, they would have done that anyway.
Right. They would have got it. But if there's most of the time we're seeing right now is breaches by the business associate and no business associate agreement in place.
Right.
That's where they're really
and that's a HIPAA compliance, like, I don't want to say 101, but that's been part of HIPAA for a long time.
Right.
HIPAA compliance, right. Do you guys have any, you said 2020, what do you see happening between now and then? I mean, do we just continue to, run malware, run virusware, do backups, encryption? Is this the standard? Is this the standard quo until we hear otherwise?
Until you hear otherwise, right? Yeah. So until they've done with what they're doing, you won't see. It's impossible to have a rule change with what they're doing. Okay, so hopefully they do make. Maybe they come up with a different rule. There's another thing that they could do, and like they come up with omnibus, right? Maybe they come up with right. So maybe they come up with something different. They call it, malware or something like that, right? And so there's this malware rule that comes out from because they've had all this stuff that's been built off of the privacy. Now turn around and build something off the security. You could see that easily.
And they're HSS. They can come up with a rule anytime that they want. I mean, there's no. I mean, there's a protocol and a format in which that process happens, obviously. But I mean, this was a topic even in the debate Monday night, cybersecurity, and which of course is the ransomware sort of, to me, falls obviously from a hierarchy. I mean, this is a cybersecurity issue, obviously, so impacts all of us. So we've got a couple more minutes, and so before we end today's HIPAA chat, any final thoughts? I'm going to go back to our slide of, whoops, if I can get there. There we go, where some of our resources are. So final thoughts on the topic. I'm sure we'll be addressing it again in the future, but certainly for today's audience.
Mark, do you want to go?
I'm sorry, I had you guys muted. I apologize. No, go ahead, Bob.
Okay. My final thought is this. The more that you do, the more that you could show your due diligence in making a good faith effort, and I mean really making a good faith effort, the more chance you have of surviving a ransomware or a breach or a virus or an audit. So the more that you could do and the more that you could document to be able to show somebody your HIPAA compliance or your security compliance, the better off you'll be. But if you bury your head in the sand and say, I've got enough, that's enough, we don't need any more, those are the people that are getting the $400,000 to $800,000 fines because they can't accurately portray their compliance. That's my final thought.
Well, and I think too, you know, I think because there are, as Mark pointed out, there are so many covered entities out there, you know, dentists and physicians and hospitals and surgery centers and, you know, medical clinics and ACOs and whatever. I mean, nobody, I think in this regard, nobody ever thinks that they're the one that's going to get targeted.
Right.
You know, you don't ever think that it's going to be you, but it probably is more widespread than all of us think. So, all right, Bob, Mark, thank you again for being our experts today on HIPAA Chat. To remind everybody who's attending, I will be getting a copy of the YouTube video out on today's session to you, as well as a copy of the slide deck. And I hope everybody has a great day.
Thank you, Carol.
Thank you very much, everybody. Have a great day. Thanks, Carol.